Chediak Higashi syndrome is a rare immunodeficiency that results in albinism and neurological degeneration. In this video, I'll give you my visual mnemonic to help you remember all the facts about this disorder so you'll be ready for test day. Welcome all to the Old Cheddar Cheese. We've been running this family-owned cheese shop for ages. You really should try the cheddar. By the way, this cheddar should help you remember the name Chediak Higashi, because the word Chediak spelled a lot like cheddar cheese, right? And it looks like our cheddar cheese shop is falling behind on orders as we speak. Just look at all those lists in the window. No, we don't call them order slips here. They're called lists, okay? Anyways, these lists should help you remember that Chediak Higashi syndrome results from a defect in LYST, which stands for the lysosomal trafficking regulator protein. List for list. Get it? A mutation in the gene encoding for lysosomal trafficking regulator protein causes defective vesicle trafficking to, well, the lysosomes. That's why it's called the lysosomal trafficking regulator protein, after all. It's not rocket science, folks. Let's move on. Anyhow, it looks like our owner ran into trouble putting the cheddar inside the icebox. I mean, fresh cheddar has gotta be kept cold, right? But wait a minute. Did you say icebox? Isn't an icebox Pixarize's recurring symbol for the lysosome or the isosome? That's right. This picture should help you remember that Chediak Higashi syndrome results from a defect in phagosome-lysosome fusion. Yeah, there ain't nothing going into that lysosomal icebox. Remember the defective lysosome trafficking we just talked about? Well, it turns out that phagocytes use lysosomes to kill foreign pathogens and bacteria. These immune cells swallow foreign bugs and put them inside vesicles called phagosomes, which in turn combine with lysosomes. The lysosome has hydrolytic enzymes and reactive oxygen species, nasty things that effectively destroy these pathogens. So in Chediak Higashi syndrome, defective trafficking to lysosomes means that phagosome-lysosome fusion doesn't happen. Consequently, these pathogens aren't killed. You can imagine how a failure in phagocytosis might lead to infections. Just picture our owner having problems putting things in the icebox to peg this failure in phagosome-lysosome fusion. Next, take a look at that cane in our owner's hands. Our boss has seen his fair share of years. To stay on the job, he uses a cane to get around these days. Doesn't stop him from dropping all this cheddar everywhere, though. By the way, this cane should help you remember immunodeficiency, because it's the immunocompromised cane. Chediak Higashi is an immunodeficiency, which isn't that hard to understand. Recall from earlier how I said phagosome-lysosome fusion is impaired, so our phagosomes fail to kill foreign pathogens. This makes us more prone to infections, also known as, immunodeficiency. This immunodeficiency primarily manifests as recurrent pyogenic or pus-forming infections. Remember that pus is mainly formed by the accumulation of neutrophils, which are recruited in greater numbers to compensate for defective phagocytosis. Functionally, we're talking about recurrent infections by bacteria like Staph aureus. Just remember our cane here to peg immunodeficiency in Chediak Higashi syndrome. But our owner is not the only reason we're running behind. Take a look at me here, pushing this small kitchen cart. We'll talk about what I'm carting around later, but for now, this small cart should remind you of autosomal recessive inheritance, since a cart is a type of small auto, right? Yep, this small recessive cart is here to help you remember that Chediak Higashi is inherited in an autosomal recessive manner. So what are the other symptoms of Chediak Higashi syndrome? Well, notice how I ran right over the wire to the icebox. Now, the wire is completely frayed. Since wires kind of resemble nerves, this frayed wire makes me think of neurological symptoms. This can include progressive neurodegeneration and peripheral neuropathy. While the mechanism of nerve damage is unclear, it's thought that impaired trafficking to lysosomes can cause accumulation of substances toxic to neurons. Also, poor vesicle trafficking to lysosomes is believed to also impair vesicle trafficking along axons, kind of like how a car accident in the middle of an intersection can lead to traffic jams in all directions. Just remember this as nerve damage in Chediak Higashi syndrome. Next, take a look at the bleached white kitchen uniforms my owner and I are wearing. We just cleaned them yesterday, and they're blindingly white. You might even say they're hypopigmented. This hypopigmented appearance symbolizes one of the most important findings in Chediak Higashi syndrome: albinism. Get it? All white uniforms for albinism? Indeed, partial to complete albinism is a common finding in patients with Chediak Higashi syndrome. Once again, the mechanism here is unclear, but it is thought that melanosomes are also impaired by the vesicle transport defects seen in the disease. The finding of albinism is high yield, however, and a history of recurrent infections and albinism should immediately point you to Chediak Higashi syndrome. All right, now to what I was carting around. Take a look at this grain-covered bread. Because bread and cheese is a classic combination, am I right? But this bread is special. It's got these giant grains on top. And do you know what giant grains makes me think of? That's right, giant granules. On peripheral blood smear or on bone marrow biopsy, giant granules are seen in cells of granulocyte lineage. I'm talking about things like neutrophils and eosinophils. The premise here being that since granules are a type of vesicle, they're also affected by impaired vesicle transport in Chediak Higashi syndrome. Yeah, I'm seeing a pattern here. Impaired vesicle transport and Chediak Higashi syndrome. This finding of giant granules is especially important because a peripheral blood smear is an easy test to confirm a diagnosis of Chediak Higashi syndrome. Finally, to close out, let's turn our gaze back to that cheddar cheese wheel in front. Did you notice the green plant thing we used as a garnish? This is no run-of-the-mill cheese shop. Everything gets a garnish. Notice how this green plant is kind of lymph-like. Yeah, this green plant is here to make you think of lymphocytes. But what about the cheese wheel? Well, the cheese wheel is shaped like it's about to consume the garnish, which kind of reminds me of phagocytosis. Yep, this phagocytic appearance should make you think of histiocytes, which include phagocytic cells like macrophages and dendritic cells. Putting this together, this picture is our symbol for infiltrative lymphohistiocytosis, a serious complication of Chediak Higashi syndrome. Basically, lymphocytes and histiocytes go crazy in the setting of excessive immune activation and go on to indiscriminately kill things. This can manifest as hemophagocytic lymphohistiocytosis, abbreviated HLH, in which lymphocytes and histiocytes attack red blood cell precursors in the bone marrow. As you can imagine, this severely reduces blood counts and can lead to life-threatening anemia. But indiscriminate attack of the bone marrow doesn't only affect red blood cells. Notice how this histiocyte-like cheese wheel and lymph-like garnish is being served on a red pan. A pan, which is a recurring symbol for pancytopenia. Pan for pancytopenia. Get it? Yep, these overactive lymphocytes and histiocytes attack precursors to platelets and white blood cells as well, causing pancytopenia. In short, HLH can lead to a triad of anemia, severe bleeding, and infection, which is often fatal. Who knew this unassuming cheese pan could represent something so dangerous? All right, that's it for Chediak Higashi syndrome. Let's wrap up and get out of here so we can get this kitchen back in order. Chediak Higashi syndrome is an autosomal recessive immunodeficiency caused by defects in the LYST protein. This causes problems in vesicle transport, which most significantly impair phagosome-lysosome fusion. Patients are immunocompromised and present with recurrent pyogenic infections, progressive neurological dysfunction, and importantly, albinism. On blood smear, giant granules are observed in granulocytes, and one complication to look out for is infiltrative lymphohistiocytosis with resulting pancytopenia. And now we're actually done with Chediak Higashi syndrome. All this talk about cheddar is kind of making me hungry. See you in the next one.